everybody, my name is Blandon and I am a nursing student here on YouTube. Today I'm going to be showing you guys how I use Unbound Medicine's Nursing Central in order to complete a concept map. As a nursing student, we have concept maps that are a huge part of nursing school. I myself have done a million concept maps, and then where I've created them myself, I've followed a template. One of the biggest struggles about completing a concept map is trying to get the information from a reliable source, but also a source that will include all the different parts of the concept map that is required. I'm going to go ahead and show you guys a couple concept maps that I have done in the past. You guys can see what the end goal is going to be at the end of this video. As you can see, I have done many concept maps. I have done them where I've done my own. I have followed a template. I have highlighted, I have gotten information from YouTube, I have gotten information from my book. So today I'm going to be showing you guys how I use Nursing Central in order to complete a concept map. If you guys would like to see how I use Nursing Central as a nursing student, then just go ahead and keep watching. Alrighty guys, so today as you can see we're going to be completing a concept map all on heart failure. As you can see, I have it on my computer. I created my own concept map just for the purpose of the video in order to show you guys how I use Nursing Central, which as you can see is here on my left side. Alrighty guys, so in order to get started, I'm going to go ahead and show you guys some of the main points of Nursing Central. As you can see, Nursing Central is a huge app consisting of several smaller apps within, and all these apps are formulated specifically for nursing students in order to aid you in nursing school. I do want to include that, as you can see, this NCLEX RN Quest right here, as well as this Nurse's Pocket Guide right here. Those ones are not included within Nursing Central when you do buy the pack, but you can always buy those as add-ons, which I definitely recommend. They are great apps to have in addition to your Nursing Central. So as you can see, the core of Nursing Central is going to be the Davis Drug Guide, which is one of my all-time favorite apps, the Taber's Medical Dictionary, the Davis Lab and Diagnostic Tests, as well as the diseases and disorders. Alright guys, I'm going to go ahead and zoom you guys in so you guys can see me completing this concept map. Alrighty, so I have zoomed you guys in. Now when I do like to start my concept maps, my favorite things to start out with are the disease patho as well as the clinical manifestation. And what would my patient be showing if I had a patient that came in with heart failure? What are the most common signs and symptoms? The app that I'm going to begin with is going to be this diseases and disorders. So I'm going to go ahead and click on that app. I'm going to go ahead and go to all entries, and I'm going to go ahead and look for heart failure. Alrighty, now as you can see, this is the heart failure tab. So a lot of the information that I'm going to get for my concept map is going to be in this app right here. Now, a way to use this app or a way to navigate this app that makes it so much easier is, as you can see on the bottom right corner of the app right over here, these lines with this little arrow. If you go ahead and click that, it'll actually close up all the tabs within that app, just so that it makes it so much easier for you to navigate the app and you can go specifically where you need to go. So you guys already know we're starting with our patho. So I'm going to go ahead and click on causes because that's where we're going to find our patho. So I'm going to go ahead and click on causes, and see it's just going to give me a bunch of information on the pathology of the disease. So I'm going to go ahead and write that in. I'm just going to take the more important information and the more pertinent information and go ahead and fill out my patho. Alrighty guys, so now that I have filled out the disease patho, while I was reading for my patho, I actually ran into my risk factors. I'm going to go ahead and highlight that on here so you guys can see. So as you can see, I actually ran into my risk factors and I've highlighted them there for you guys to see. So I'm going to go ahead and fill out my risk factors in addition to my patho. So I'm going to include all of those things for my risk factor. Alrighty, now you guys can see I have completed my risk factors. Now I do want to show you guys a couple little tricks about Nursing Central that are really helpful as a nursing student. So while you guys are reading, if you run into some great information that you did not know, or some information that you believe will help you on the exam and you want to save that information, what you can do is, you see how I've highlighted here my risk factors. All you have to do is hold down the words. And once you've highlighted and found the information that you want to go ahead and save, as you can see, a couple things will pop up right up top. You can either click share, and you can send it wherever you would like, or you can also click on note right here. Once you click on note, you can actually create a note card and it will save that information there for you. So as you can see, it is now highlighted. So if you're reading that information, you want to make sure that is something you don't want to forget, you can go ahead and highlight it super easily here on the app while you read. Alrighty guys, so now that we're done with our risk factors, we're going to go ahead and move on. So as you can see, Genetic considerations are also included here on the app. I can go ahead and include that in my risk factors, but just for the purpose of the video, I'm just gonna go ahead and skip it since, as you can see, my risk factors box is already full. But if it were for an exam, I might include some of that genetic disposition in my concept map. Since I finished with my patho and my risk factors, I'm gonna go ahead and close out the apps. Remember, I did that by using these lines right here as well as this arrow. We're gonna close that up and I'm gonna look specifically for my manifestations. So it's gonna be whatever my patient comes in showing, so it's gonna be my signs and symptoms. So what I'm gonna do is go ahead and click on assessment right over here. And as soon as I hit assessment, you can see that it shows history. It's gonna show physical examination, psychosocial, and diagnostic highlights. As you can see, those are all different parts of what I need for my concept map. So I'm gonna go ahead and scroll right back up over here. As you can see, I'm gonna have some of the clinical manifestations from their history. I'm also gonna have some from physical examination. So I'm gonna go ahead and write those down. Alright guys, as you can see, we are all done with the clinical manifestations. And as you can see on the app, the next topic is gonna be diagnostic highlights. So we're gonna go ahead and skip over here to our diagnosis studies, and we're gonna go ahead and include those. Alrighty guys, so I'm all done with the diagnosis studies, and as you can see, we are almost done with our concept map. All we have are a couple more things, so I can either go ahead and keep scrolling and looking for what I need, or I can collapse and see all of my topics here on the disease and disorders app. So remember you guys, I'm gonna click right here where all these three lines are, on here on the bottom of the app. And there we are. Alrighty guys, so the next thing that I want to look for is gonna be my nursing assessment, my nursing interventions, and my drug therapy. So I'm gonna go ahead and click here on planning and implementation. As you can see, it is grayed out right now on the app right over here. So I'm gonna go ahead and click on that. And on here, it's gonna tell you the medical interventions that you can do, surgical and other measures. And then down here, it's going to tell you the pharmacologic measures that you can use to treat heart failure. So those are going to be what we're going to fill in for our drug therapy. And then for client teaching, you can go ahead and include this independent right here. This independent tab is actually going to be what the client can do for themselves in order to help their disease process. So all that information is what I'm going to be included in my client teaching so that they can know the ways that they can help themselves and to help their disease process. Of course, we want to keep our client as informed as possible and as involved in their care plan as they can be. So we're going to go ahead and fill in our drug therapy as well as our client teaching, and I'll be right back. Alright guys, so now since I finished my drug therapy, as you can see, I wrote all those drugs out right there. I'm going to go ahead and move to this little independent right here, and I'm going to go ahead and fill out my client teaching. So as I was filling out my client teaching, I actually ran into some nursing intervention. So as you can see, what I've highlighted right here, it says provide ongoing monitoring through the acute phases of the patient's disease, monitor the patient for signs and symptoms of fluid overload, impaired gas exchange, activity intolerance, and etc. So all of those things are going to be nursing interventions. Now as a nursing student, I'm sure as you guys are learning these disease processes, you can start to figure out exactly what are going to be nursing interventions, what are nursing assessments, and things like that. So as soon as I read all these things, I already immediately figured out that those were going to be some of my nursing interventions and my nursing assessment. So I'm going to go ahead and jump over here to my nursing assessment and my nursing interventions and start filling those out as well. Alrighty guys, so as you can see right down here, we've gone ahead and skipped over to education as well. So we're going to go ahead and go back to our patient education or our client teaching and go ahead and add those extra last points in. Alright guys, so as you can see, the only thing we have left is our complications, which is right up here on the top corner. So it's not going to be something that's going to pop up here for you, but I'm going to go ahead and show you how you can find it. So usually in the discharge guidelines, that's going to be somewhere where we're going to find our complications. So I'm going to go ahead and click on discharge. As you can see, it is now grayed out. You can see right here we have our complications of HF. So we're going to go ahead and include that, and we are almost done with our concept map. Alright guys, so as you can see, we are about done with our concept map. So I'm going to go ahead and show you guys some cool tricks on Nursing Central. You're just now learning heart failure and you don't know anything about these drug therapy medications, as you can see right here. Now, if you don't know anything about these drugs, this list right here absolutely means nothing to you because you do not understand what any of these words mean. So we're going to go ahead and go back to our Nursing Central. You can see right here we are back home at Nursing Central. So what you can do if you have never seen these drugs before and you want to learn more about these medications, which for my exam I needed to know a lot about my heart failure medications as well as well as for pharmacology. You're going to learn these medications. You can go ahead and click right here on the Davis Drug Guide, which is another app here in Nursing Central. So I'm going to go ahead and click on that. I'm going to go ahead and go right over here to all entries, and you can look up any of these medications. So if you're learning about specific drugs that teacher just told you need to know, lisinopril is something that's going to be on your exam, and you want to learn a little bit more about lisinopril. You can go ahead and type in lisinopril, and the Davis Drug Guide right here is going to give you all the information you need to know about lisinopril. Now, although I'm not including a lot of information here on my drugs, usually what I like to do is, in addition to my concept maps, I like to have a med sheet attached to it just so that I know what my meds are. Since heart failure is something that was really big in my nursing school, that is exactly what I did. As you can see right here, these are all my heart failure medications. So all this information that you see here, I actually pulled from the Davis Drug Guide, and this is how I studied my medications for my heart failure. So I went ahead and broke everything down so that I can understand it, and I wrote down the more important topics for my drugs. Now, let's say that you are, let's go back over to our diseases and disorders, which is where we started for our concept map. So let's say that while you're filling out your concept map, you want to know what the drug is right now. Since you just read over the drug itself, you can go right over here. So as you can see, these two arrows right here on the bottom corner, right next to our little star, right over here. You can go ahead and click on that. Now, if you click on that, as you can see at the top, it's going to say cross links for heart failure. So these are all going to be things that are going to be very important, and all things that are related to heart failure. And right here, we'll cross link everything in Nursing Central for you, so you can find everything related to heart failure in Nursing Central without having to go through a bunch of different apps to find the information. Now, another great thing about Nursing Central is while you are reading, if you find a word that you don't truly understand, all you have to do is go ahead and click on the word. You're going to click on this little arrow over here, find glimpse. So I'm going to go ahead and click on glimpse, and it's going to take you straight to our Tabor's Medical Dictionary, which is another part of Nursing Central. So it'll give you all the information on perfusion, what it means, different things that it could be used for, but most importantly, it'll give you the definition right up here. So as you can see, there's 4 different definitions on what perfusion could be, so you can go ahead and figure out what they're using it for in whatever reading you're doing. Now let's say you're in clinical and you have a patient with heart failure and you're taking care of that patient. You're reading their chart and you see all these labs that are all out of whack, or all these different exams done. You have no idea what those exams are. As you can see right here for the DX studies, we had an echo. Now let's say you don't know what an echo is. And click right over here on the Davis Lab and Diagnostic Tests. So we're gonna go ahead and click on that, click on all, and you can go ahead and look up echo. So we're going to go ahead and click on echocardiography, and you can see exactly which one you're looking for. I'm going to click on echocardiography, and it's going to tell you everything that you need to know about that diagnostic test, what it's used for. As you can see here, the rationale is going to be to assist in diagnosing cardiovascular disorders such as the defect, heart failure, tumor, infection, and bleeding. And obviously our patient does have heart failure. So it'll tell you what the normal findings are and what the abnormal findings are that we might find in a patient with heart failure. As you can see, Nursing Central is such a great tool. It has such great shortcuts to make everything so much easier for nursing students. Ever since I started using Nursing Central, it has made my concept maps so much easier. As you guys could see, we now have a completed concept map, and we did that with the use of one app. And normally this would have taken me such a long time in order to find all this information, especially while at the hospital. So having this app as a tool on your phone is extremely helpful, because no matter what you're doing, whether you're in the hospital, you're in clinical, you're in class, you're able to pull out this app and be able to find all the information that you need to know for any disease process, any medications, anything like that. So it's a great tool to have as a nursing student. I really hope you guys enjoyed this video, and it simplified Nursing Central a little bit for you in order to complete a concept map. And if you did, make sure you give this video a thumbs up, and I really hope you guys have a great day.